do surgery with radiation or radiation with surgery, any one of them, combination. First radiation, then surgery, or surgery with radiation, and chemotherapy also. Because all these are called squamous cell carcinomas, which are the best kind of cancer. If you have to have a cancer, have a squamous cell carcinoma, because every treatment works on squamous cell carcinoma. Surgery works, radiation works, chemotherapy works. So the head, face, neck, that is the common cancers in India, almost 60-70% of cancers in India are the head, face, neck cancers. These cancers are amenable to all the modalities of treatment. You don't need to
सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में।
हेलो एवरीवन, वेलकम बैक टू आवर चैनल सर्जरी सिंप्लीफाइड, शस्त्र कला सरल शब्दों में। मेरे साथ हैं डॉक्टर निखिल।
नमस्ते।
सो आज हम अदर लम्प्स ऑन द नेक के बारे में डिस्कस करने वाले हैं।
Basically lumps in head, face, neck. Let us put it head, face, neck.
अच्छा।
So we are going to cover some lumps in the salivary glands and lump in the neck. So last time we discussed the main and the commonest lump in the neck, which is the thyroid gland. I forgot to mention one important symptom over there, which is the thyroid gland always moves on swallowing. So if you ask the person to swallow, the gland will move up.
Correct.
So that is how you know that it is the thyroid and not something else. Other lumps don't move. That means that the lumps that we are going to discuss today, they don't have any connection to swallowing or what is called deglutition. Okay, so lump that moves up on swallowing is a thyroid lump, unless proven otherwise. Okay, so the earlier clinical ways to know that this is a thyroid gland before ultrasound and other things, when we were learning our surgery, ultrasound was not there. So the only thing was palpation and the sign that the gland moves on deglutition. Of course, the other tests were available, T3, T4. So let us now discuss about another very common condition, as common as thyroid maybe, is a lump in the side of the neck, any one side. Okay. So basically a lump in the side of the neck is an enlargement of the lymph nodes which are there in the neck. If you remember, we have discussed this earlier also, lymph nodes are present in the neck, they are present in the axilla, they are present in the groin, and some areas in the intestine like the appendix, the last part of the ileum. Their function is to produce B cells, B cells are antibodies. These produce antibodies to fight infection. So what it does, it concentrates the infection to itself and tries to destroy it. The same function also happens in cancer. So some cancers or most cancers, they first spread to the draining lymph nodes. For example, cancer of the breast will spread to the lymph nodes in the axilla. Cancer of the penis or of the external genitalia of ladies will spread to the groin lymph nodes. Similarly, all cancers in the head, face and neck, including thyroid cancer, will spread to lymph nodes in the neck. Okay? So what are the cancers which can spread to the lymph nodes in the neck? Any cancer on the face, lips, tongue, mouth. These are seen, right? And the commonest cancer in our country is related to these cancers because of the tobacco chewing and smoking, especially tobacco chewing. Because when you keep tobacco in the mouth here for a long time with that tuna, it's very irritant. And when it irritates, it makes changes of cancer.
Okay.
So it's directly related to tobacco chewing or gutka eating. Alright? So cancers of the oral cavity, lips, tongue and the palate, soft palate, all these parts which can be seen, they spread to the lymph nodes here. The second cancer, which sometimes they present only with the lymph node but you can't see any cancer, are the inner parts of the throat and neck, which is called the pharynx and the larynx. That means from the nose, when you draw the side of the nose, you see that it goes down into the windpipe and the tongue goes into the food pipe. So this tongue going into the food pipe is called pharynx, and the nose going into the windpipe is called larynx. And we discussed last time that the larynx has the voice box with the vocal cords. So one of the common sites for cancer is in the region of the vocal cords, which is not seen from outside, right? But when it spreads to the lymph nodes, then the patient comes with lymph node, and sometimes the patient comes with hoarseness of voice or change in the voice. Not necessarily hoarseness, but change in the voice. If the voice was loud, it has become soft. Sometimes it has become hoarse and it has become soft, right? And very rarely they have breathing difficulty. If the tumor is large and it is blocking the vocal cords open and close in the air going up and down, that's how you speak. So if it grows and it interferes with their movement, then you will have breathing difficulty, right? So breathing difficulty, change in the voice are signs of cancer of the larynx, which is spread here. Cancer of the pharynx is, there is no specific symptom until it grows very large, but early symptoms, nothing, only lymph node enlargement. So if a patient comes with a lymph node enlargement, what are the things that can be there? If it is a small child, congenital problems are there. That means birth defects called cystic hygroma, which is fluid filled with lymph. Because the lymph nodes are not developed properly, it forms a big cyst. It's very small children. Rest of the people, it is either tuberculosis, we discussed this in tuberculosis, lymph nodes which affect the tuberculosis affecting the lymph nodes in the neck, or cancer spreading to the lymph nodes of the neck. These are the three things. Cyst, which is a lymphatic cyst in younger children, then anybody else will be tuberculosis or cancer. So if it is younger adults, because generally the tuberculosis affects young adults, teenagers. Older people who have history of smoking or working in certain very polluted industries like coal industry and all that, miners and things like that, or engine drivers, and where there is a lot of smoke coming, they could be getting cancer in the air passage inside. Alright, such people, even if they don't smoke, you have to think that it might be cancer. So, how do you differentiate clinically? In the case of tuberculosis, it is known as a cold abscess. Now abscess is a collection of pus. So what is a cold abscess? So in Latin, the abscess was determined by 4 points. Calor, temperature, calorica, calor, temperature. Rubor, R-U-B-O-R, redness. Okay. Tumor, swelling. And dolor, which is pain. That's why that tab dolo is there for pain. So dolor in Latin is pain. Tumor is tumor, swelling. Calor is temperature and rubor is redness. So these are the 4 signs of an abscess. But in this, lymph nodes in which cause tuberculosis, lymph nodes of the neck, you get red color of the skin, you get pain and you get a swelling, but you don't get temperature. That's why it's called a cold abscess. Cold abscess. And you get the lymph node becomes enlarged, matted. That means multiple lymph nodes matted. Like if you think, if you would to feel a sitafal, sitafal, how it will feel, same kind of feeling you will get over here. Multiple nodules and big mass like this, and of different consistency, little soft, little hard, somewhere firm, somewhere soft, with the skin reddish. Sometimes, may not be reddish, may be reddish. If you put a needle, you will be able to aspirate pus also. So the treatment of this is to first do an ultrasound exam to see whether there is any liquefaction. If you get something aspirated, do a fine needle aspiration cytology, where you will be able to see the tuberculosis germs. You can do a blood test for tuberculosis and a skin test for tuberculosis, and even a chest X-ray to see if this chest X-ray is showing any tuberculosis in the chest, right? Once you know it's tuberculosis, if it is very large, you can do removal of partly remove all the pus and everything, and put the patient on anti-tubercular treatment for 9 months to 1 year. Okay. Once you confirm the diagnosis. Okay. Now, what is the difference between the lymph node mass which comes in cancer and this? In cancer, the lymph node mass will be less nodular and more smooth. It could be nodular, but generally it is more smooth. It is hard. It feels like a hard tumor, hard. And it doesn't move because it is infiltrating into the surrounding tissue. There also you take a small and then you can do a true cut biopsy needle or a FNAC. And then here, if there are no symptoms or even if there are symptoms, you need to find out which is the primary. So you can use telescope which can go into the nose, go into the larynx, which is known as a bronchoscopy or a laryngoscopy, and a pharyngoscopy, tube which goes into the part of the throat which is above the food pipe, and see if there is any cancer. You take a biopsy. Now, in early cancers of the lung, of the pharynx and larynx, radiation therapy is one therapy which you can give. So you give radiation therapy, the nodes may also shrink, cancer may shrink. If it doesn't, you can remove them surgically. The other treatment is to do removal of the neck, that is a radical excision of all the lymph nodes of the neck along with the radiotherapy, or you can remove that part by surgery inside, the whole part. So then what they do is that the trachea is brought from here with a permanent tracheostomy, because the upper part of the windpipe is gone. So how will they breathe? So there is a permanent tracheostomy and they cannot speak. Now they have got other ways of generating voice by putting like this. It will sound like a machine ka voice,
Right.
So that is there. Alright. So the mainstay of treatment is to do surgery with radiation or radiation with surgery. Any one of them, combination. First radiation, then surgery, or surgery with radiation, and chemotherapy also. Because all these are called squamous cell carcinomas, which are the best kind of cancer. If you have to have a cancer, have a squamous cell carcinoma, because every treatment works on squamous cell carcinoma. Surgery works, radiation works, chemotherapy works. So the head, face, neck, that is the common cancers in India, almost 60-70% of cancers in India are the head, face, neck cancers. These cancers are amenable to all the modalities of treatment. You don't need to, but the cancers inside the stomach, liver cancer, stomach cancer, this cancer, they are adenocarcinomas. They are more amenable to surgery rather than radiation and chemo. Of course, if it is late stage, chemotherapy is given now and radiation is also given, but predominantly the best results are with surgery. So that way, these things you can avoid surgery also. In the early stages, radiation gives very good results. And another thing is squamous cell carcinoma compared to adenocarcinomas spread less quickly, and they spread more to the lymph nodes rather than the bloodstream. But adenocarcinomas tend to spread more through the bloodstream. Of course, they also spread to lymph nodes, but they spread faster. So they give you less time to diagnose and treat. If the patient comes, so generally adenocarcinomas patients tend to come in later stages than squamous cell carcinomas. So this is about the lymph nodes in the neck.
Correct.
There are some more swellings which I wanted to speak about, which is the tumors of the parotid gland. There is a parotid gland here, the salivary gland, and a submandibular gland here, below the jaw, inside. So a swelling over there and a swelling here, it will come out like this and raise the lobe of the ear, like this. That is a parotid gland. So even parotid gland and submandibular salivary gland can have tumors. But 70% of these tumors are benign. They are known as papillary adenomas. Alright? So they are benign. But 30% can be cancer also. So there are two types of cancer. Again, slow growing and fast growing. The slow growing cancers are more amenable to surgical removal and then if required chemo or radiation. And fast growing, they are less amenable to treatment because they grow very fast. Now, one important thing you have to remember, that the submandibular salivary gland, just like the thyroid had recurrent laryngeal nerve, the submandibular salivary gland has the nerve supplying the tongue. The hypoglossal nerve and the glossopharyngeal nerve, they go very near to the submandibular gland. And in case of the parotid gland, the facial nerve which comes out onto the face and is responsible for all these movements, your eyebrows, your eyelashes, your eyes closing, blowing like this, smiling, all these are, so it comes like a nerve like this and divides into 5 branches, starting from the forehead to the eye, to the nose, to the cheek and to the mouth, right? Therefore, any surgery, because what it does is it goes through the gland So there is a superficial part and a deep part of the parotid gland, superficial to the nerve and deep to the nerve. Luckily, most of the tumors appear in the superficial part of the parotid gland. So you can remove only the superficial part with the nerves intact. But obviously when you are doing surgery on parotid, sometimes the nerves get injured and then therefore you may get, your mouth may go like this, or you may not be able to close your eye properly, whatever, whichever branch is injured. And if it is malignant, then it is very difficult to save the facial nerve. So you have to remove the gland, but you can do a plastic surgery to then reconstruct so that that twisted look of the face goes away. You can do it. There is surgery available, including nerve transplant. So you can cut the facial nerve here and all the branches and then do transplant the nerves. Take a nerve from here called the sural nerve and you can do. Or you can use a facial sling to lift up the face, because it's like the face sags on one side. So different procedures are available depending on what the need of a patient is. So just like after cancer of the breast, you can reconstruct the breast. In cancer of the parotid, which is malignant and you have to sacrifice the facial nerve, plastic surgery procedures are available to improve the facial look.
Got it.
Yeah. So again, the prognosis is good because these are superficial tumors. So immediately patients come to doctors because they can see the lump over there.
Correct.
Right? Therefore, take home message, again, any lump in the neck, please show it to a surgeon so that he can evaluate it and decide whether it needs surgery or not. Most of them will need surgery. Remember this, because they are associated with some tumor. In case of lump in the neck here, even if it's tuberculosis, you may need surgery. Parotid and salivary gland, you have to do surgery because it will interfere with the functioning of the gland, with the secretion of saliva, and it can, the benign tumors can over a period of time, if it is for a longer period of time, it can become malignant. What is the sign of malignancy? You will find that your facial nerve gets affected. Benign tumors don't affect the facial nerve, but after some time, if suppose the tumor is there for some time, and then your mouth becomes crooked, or your eye cannot be closed properly, or you cannot blow the cheek on that side, it means that it is now becoming malignant. So why wait till it becomes malignant? You can always get surgery. See, the principle in surgery is, if a condition needs surgery, get it done faster rather than keep on postponing it, because by postponing it is only going to make it worse. And maybe you will end up with more surgery than you could have had the thing done with a simpler procedure at an earlier stage.
Alright, sure. Thank you so much, doctor. So if you have any queries, anything that you want to share, do let us know in the comment section, and share our video, share our channel, subscribe to our channel, and stay tuned for more episodes.